All right. We're just about to the top of the hour here. So let me know once the trickling in has stopped there, Nicole, and then we'll go to it.
Yeah, we're at about 40 people, still going up.
Okay.
All right, you can go ahead. It's stopped.
All right, fantastic. Good afternoon and welcome back to our New York Association on Independent Living 2024 webinar series. I am Blaise Bryant, the communications specialist for the association. A couple of quick housekeeping things before we get to the presentation. Number one is the chat is disabled for attendees. This is because the chat creates accessibility issues for folks like myself who utilize screen readers. So the chat is disabled. So how can you ask your questions? You can do that in the handy dandy Q&A box that is on your screen. So that's the best way to ask your questions. And the other bit of housekeeping is there is a survey at the end of the webinar that'll show up on your browser once you exit. If you would be so kind as to take that, because that helps me as the planner of these webinars develop more content for them and build out the calendar and series. So with all of that out of the way, I'm going to introduce our presenters. Glenn Liebman, who is the CEO, President and CEO of the Mental Health Association of New York State, and Katie Oldakowski, who is the Director of Training Programs for the Mental Health Association, or as we will probably more commonly refer to them by their acronym, MHANYS, MHANYS. Without any further ado, Glenn and Katie, the floor is yours.
Thank you so much, Blaise. I really appreciate this opportunity very much. It just, it's so fortuitous that you reached out to us, because we are aligned with the independent living centers in so many ways. We have great respect for the work that you all do. You do incredible advocacy, and I'm not just saying that. I've seen it firsthand. When you're walking the floors of the Capitol at the end of budget, there are people who talk about being at the Capitol and saying, I'm here, I'm there. You were there. The independent living folks were all over the place. They redefined what advocacy is. It's just the most hands-on organization. And I'm just so impressed by your work and your grassroots efforts. So I'm going to talk a little bit about our advocacy. We're going to talk a little bit about our organization, and then I'll hand it over to Katie. And Katie runs our training center and is also our leader in our mental health, our youth and teen and adult mental health first aid, which is really a huge part of our work these days. And Katie's been with us for a little over a year and has done just an outstanding job in really bringing our trainings out to the community. And hopefully, you all in the Independent Living Center space will also, take advantage of these trainings as well, because we're really trying to be out there. And most of these trainings are no cost or very low cost. So we're really trying to be out there and being supportive. And, that's what we do at MHANYS, where we try to be very mission focused. Very proud of the work that we do. There's our mission statement. We improve the lives of individuals, families, and communities by raising mental health awareness, ending stigma and discrimination, and promoting wellness and recovery. And that, like you in the independent living world, we more than talk about it. This is how we live our mission. We do it every day. This is our focus. And, I get to work with a wonderful staff and a great board all the time that really recognizes the importance of the work that we do. So I'll talk a little bit about the work that we do. First of all, the important thing to recognize is we are an affiliate network. We have 26 members in 52 counties across New York State. Largely, they provide community-based mental health services, but a lot of them are also advocates in their community. They do a lot of networks, and they do a lot of trainings, and they're really out there in terms of, educational presentations. And, they are very much, if you've seen one MHA, we always say you've seen one MHA. We are as large as a $50 million, MHA in Westchester, and we have small MHAs in some of the rural counties across the state, but we're all really bonded together by the work that we do. Next slide, please. So what we do, our three tenets of what we do, or we do a lot of advocacy and policy. That's what I spend a lot of my time working on. We do a lot of that, but in recent years, due to the COVID-related issues and the rise, and frankly, in people talking much more openly about mental health, we do a lot more training and certification as well. And we also, of course, provide support. This is a huge part of the work that we do every day. And we recognize that, as we talk about the stigma of mental health issues, I've been doing this, I've been director here for 20 years. And before that, I worked in state government and was director of NAMI for several years. So I've been around a long time. And I've got to say, the fabric of stigma has changed, but we're not naive enough to think that it's still not there. You see it in disabilities community every day, you see it in independent living. There is still discrimination that continues to exist. And yes, things have gotten better, but we still have so much more to do. Next slide, please. So here's our programs. And then I'll talk a little bit about our advocacy as well. We are, we were very, very proud that in 2016, we were able to get legislation passed. New York became the first state in the country that mandated the instruction of mental health in schools. No other state has done it, and frankly, no one's done it since, where it's a mandate that schools have to, and we all know people hate the word mandate, but the reality is that schools have to teach about mental health as part of their health curriculum. And that by itself was, it was a wonderful accomplishment, all that, but the reality was, okay, a lot of schools are already doing that. One class a year doesn't sort of change that, but the reality was it did change perceptions. That all of a sudden, the state education department, the Office of Mental Health, were talking a lot more, we're having a lot of conversations, and you saw schools themselves, a lot of schools pivoted. A lot of schools that didn't even talk about mental health in schools or mental wellness, they pivoted into having conversations, figuring out ways that they could provide a school environment where mental wellness was part of that. It wasn't just like, we wanted to make it clear from the start that it wasn't just identifying the 1 in 5 young people that has a mental health diagnosis. It's not about a diagnosis. It's about wellness in general. It's about how you can have conversations about mental health, feel good about it. What can we do to end that, discrimination and stigma that continues to exist? And I think, our resource center team is doing a great job of going out to schools, talking to students and administrators and teachers about wellness and about good mental health and what that all incorporates. So that's part of what we do. And, again, I urge you to come at the end to go to our website, and you can link to our school mental health resource and training center. We have lots of programming we do all the time. We have webinars that seem to pop up almost on a, certainly on a weekly basis, if not a daily basis, around really topical areas that are very important to us. And that's part of what we do. And that was a real strong advocacy victory. It took, as many of you know, this stuff doesn't happen overnight. It took several years of continual providing facts to the legislature, to the administration, to let them know that this is so important. And what was very helpful, frankly, was that a lot of the school organizations, they were in tune to it. They recognized that mental health had become a burgeoning issue. And this is all pre-COVID. They recognized that this was a burgeoning issue, and they knew they had to do something about it to get on top of it. And a lot of schools, again, didn't need the legislation to do that, but a lot of schools were doing it on their own. But the legislation, we like to think, was sort of also a prompter to ignite sort of the agencies, the schools that weren't doing a lot around that space. The other thing I want to talk about is mental health community partners, which is also, they and the Care Path program, the next one, are very much aligned with each other. They're our program, they're our whole health program, and developed actually internally by our director of our program, Deb Faust, who basically took the tenets of family engagement and peer engagement and melded them together and said that we have seen too many times where individuals are expected to recover on their own, that they don't have a community behind them, they don't have their loved ones behind them, and their loved ones does not, or their family behind them. That does not have to, family does not have to be defined as a biological parent. It could be a close friend, it could be a brother, sister, sibling, it could be a grandparent, it could be anyone. But they, along with the individual, should be part of the process. It should be whole health learning, and it should be a whole health educational process where they work together to, ensure an individual's recovery. So we have a training grant through the Office of Mental Health to go out to the community and to train people around community partners and around the Care Path program. So we have this training program. It's about eight or 9 hours, and it teaches people so they can be the trainers, so they can go out and work with individuals so they can become community partners in their communities. So an agency might say, geez, we're having problems engaging the individual and their family. What can we do? Well, maybe the additive program that you can do is to be part of the Care Path or Community Partners program to find out about it. And you can go out, and with that skill set that you're taught through our trainings, you can go and become an expert in engaging families and individuals. So it really, and it's for all ages, and actually it's above age 16. It's really incredibly powerful, and we're very, very proud of the work that's done there. Mental health first aid, you're going to hear a whole lot of that from Katie, who really has been fantastic in terms of raising awareness and expertise around mental health first aid. But I just want to take a minute before I hand it over to Katie to talk about our advocacy. And I think this is a shared advocacy with independent living. And, we've talked to Blaze, talked to Lindsay about this before, is that we are really very much engaged in a lot of strategies around specifically workforce, where we know wherever we talk to anyone, workforce is a huge issue for all of us. And we have been fighting for several years, many years, frankly, for a cost of living adjustment for the universe of the human service community. And we have to make sure that independent living centers are part of that COLA as well. And, we have to do a really good job of working together with all of you to ensure that that happens. So we have fought many years for, a COLA. And frankly, Governor Hochul has been more responsive than any other governor combined. You take the last 17 years that we've had a COLA, the last 3 years since she's been governor have basically added more in 3 years than we've had in 17 years combined. So she's done a really good job, but it's not enough. And it's still not the full value of the COLA. We are so far behind. We're like about, our calculations are about 33% behind for not getting, for all these years where the COLA has been ignored by the executive and by the legislature. So we're so far behind, and we're just really have so much to do to catch up. We don't have to explain to any of you, because you're living it you're living it, you're working in this environment every day, how important it is to have a well-trained, well-educated, funded workforce. And we can get into the weeds and talk about our frustration and what it means when you have huge turnover and huge vacancy rates. I'm a family member of an individual with, who's had mental health issues and substance use issues over the years, thankfully doing well, but I can tell you firsthand, and you all see it too, it's like you're working with someone, you have developed this great relationship with an individual, a care manager, a peer, whoever, and then boom, a month or two later, they're going to work for Amazon because they might not like working at Amazon and they might love what they're doing, but they're getting paid $10 more an hour. And that's the reality of the world we're in. I often say this, I say that, people who enter our fields are mission driven. They wouldn't be doing it if they didn't believe in the mission of our organizations, whether they're independent living, mental health, substance use. They wouldn't be doing it if they didn't believe in the mission. But the reality is mission doesn't put food on the table. We have to be stronger in that area. And to that sense, I will also talk about an issue. And again, I could talk about 400 issues, but I'm really just going to focus, in our limited time around workforce specifically. So we have another issue around workforce, and it's percolating in the legislature now. There was a story in the Times-Union about it a few days ago. It's something novel. We're looking to be innovative and we're looking to be creative. And so what we're doing in independent living and sign on, thanks to Lindsay, I appreciate you all signing on for that, is basically we want to see the cost of, why don't we talk about retirements and pension systems for the not-for-profit sector? How come we have been ignored for so many years? Back in 1920, when Al Smith was governor, he signed legislation that basically created a pension system for the state workforce, for city workforce, for county government. How come we were left out of that 100 years ago? We are nonprofits. We do the work of state government. State government pays us, and pays us, frankly, less than most state employees do. They give us this money, and yet we were never part of a pension system. So over the last 100 years, schools, and again, this is all appropriate. We're not saying they don't deserve this. Schools and firefighters, police are all getting pensions. But yet we do this work and we are not given any sort of compensation. When most of us retire, we're retiring with what we put into our 403Bs, whatever we have in terms of retirement, but any sort of pension or retirement system, that's like, basically here's your hearty handshake. Thank you for being with us for the last 30 years. And that's not right. And so we're trying to do something about it. We have created, we know we can't tackle this overnight. This is like an Everest to tackle this overnight. We know that. But the first thing we want to do is we want to study it. And people don't love study bills. I get that. But this is the reality of the world we're in right now. We want to cost out how much it would be to create some sort of pension or retirement system for our nonprofit sector. There are 800,000 people in our nonprofit sector. How much would it cost to create some sort of retirement or pension plan for our sector? And we could talk about, if we're able to get some state dollars, maybe there could be a federal match. We don't know. We don't know anything. That's why we just simply want to do a study bill to support this idea of bringing together the three major state agencies that are involved in the pension system: the State Comptroller's Office, Taxation and Finance, and the Department of Financial Services, bringing those three agencies together to identify and find out how much it would cost to be innovative, create a retirement system, do any of that. And frankly, we're working with Cornell University. They'll have a paper they're working on with us that will be coming out in the next week or two. Unfortunately, it will probably come out after legislative session ends, but it's gonna, we already know the findings. It's gonna show that, despite the mythology that young people are, portable, their portability is their big issue. They only want to stay in a job for 2 or 3 years. They don't want to move on. Well, that's not true according to these numbers that Cornell's worked with us on, that over 83% of the people who've been surveyed want a pension system. Outside of higher wages, it's the #1 priority for them. So there is a retirement system and need out there. And I think it's clearly articulated in this report and all the work that we've been doing in this area. So just for promotion purposes, that we're looking for supporters, because it's not likely to pass this legislative session. We know that, but still there's always hope. But so we're looking for legislative support. If you or your organization are interested in supporting it, the bill is A6839 or Senate bill is 8660. If you're interested, please text me afterwards or text Blaze and let us know if you are interested. We have over 50 sponsors now, and we're really trying to up that list. So again, I can talk forever about some of our educational work and some of our work around college mental health as well, which is a huge issue for us. There's also some pending legislation we're trying to get created because of the fact that there's not great mental health advocacy and work around college campuses. And frankly, what we're trying to do is codify the Yale settlement agreement. The Yale settlement agreement occurred, and it's similar to the Stanford agreement that basically occurred because someone with a mental health issue who dropped out of school because of mental health concerns were treated unfairly. Were not given the same priority, same options as someone with a physical health issue. And I know this is stuff that you all face all the time. This is a human rights issue. This is an issue of fairness and parity. And the fact is that we're trying to quantify that and take that language and make sure that that language is part of the education in higher ed, that schools can't say, well, you have a mental health issue, you have to drop out and you're not going to get any ability to come back into the class down the road. You're not going to get any funding, you're not going to get any additional funding. You're not going to get any of that. You break a leg, completely different issue. You can completely keep your credit, there's no financial impact. So we think it's discrimination, and we're going to continue to fight that. So that said, again, I could talk forever. So that said, I will hand it over to Katie, who can talk about some of the great things we're doing with training. And of course, any questions or comments, we'd love to hear them. So Katie, the screen is yours.
And I definitely thought you were going to be leaning more into some of the workforce stuff too, because I feel like the COLA, that was such a brief COLA presentation.
For me, yes. I could talk about COLA for 4 hours, but I will also want to give time for you to speak also. And at the end, if we have time, I can certainly talk more about the COLA and the need and basically what happened to us this legislative session and our advocacy for 3.2 and ending up with 2.7, and where there was a bifurcation of the COLA, where part of it was for a COLA and part of it was for workforce. So that's an issue, and certainly we can elaborate on that. But Katie, I wanted to give you time.
Sure. Thanks, Glenn. So it's just answering Patricia in the chat. We are really excited about some of the training that we offer through MHANYS here. One of the things that we have kind of tackled on a whole level is mental health first aid. And so initially, when Blaze had reached out to us, he was talking about the wellness that is kind of a highlight now, and how do we foster wellness in our support systems, in ourselves, in the people that we work with. And I think looking at the mental health first aid, this is one of the many ways that we help foster wellness. I truly think that when we think of wellness, part of that is, what is wellness? How do we define our own wellness? Glenn did a really great job talking about some of the programs like CarePath, mental health community partners, and how do we frame wellness in a way where it really is well. So my background is actually in crisis work and crisis intervention. I came into MHANYS, we know that the system, there's gaps in the system, there's gaps in healthcare and treatment, in different ways that we access care. And for me, how we came through and looking at advocacy and training and having conversations about mental health, about substance use, about wellness at home in our own ecosystems became a really big priority for me. Mental health first aid, which is one of the many trainings that we offer, is an internationally recognized training. History is, it started in Australia in the year 2000, kind of evolved into this huge global movement based on the need to have better conversation about mental health. MHANYS brought mental health first aid into the fold. We started with adult in 2010. We moved and expanded into youth. So adult mental health first aid, as you can guess, is for adults talking to other adults. Youth mental health first aid in 2014 is talking to adults who engage with youth ages 12 to 18. And then in 2023, we took on teen mental health first aid, which is actually talking to teens about how to talk to other teens about mental health. And so we kind of took it and ran with it. Mental health first aid and MHANYS were a seamless partnership in creating community literacy about wellness and how do we talk about mental health. So what the training actually is, so it's evidence-based. I know some people hear the term evidence-based and it's like, does that really matter? I don't know. There's 47 studies, I think, that prove the confidence in skills goes up. So we use it as a evidence-based literacy program. And one of my favorite things about this training, and I'm an instructor in the adult and the youth, is it talks about signs and symptoms of a mental health and substance use, but not the diagnosis, right? We cover diagnosis. We want to talk about it, but that's not the point of the training. It's really teaching everyone how to have conversation around mental health and substance use in a productive way, where it's like recognizing the symptoms for what they are as early signs and symptoms, worsening signs and symptoms, and then kind of as we move into a crisis scenario. So you learn different skills. We didn't put all the skills in here, but it's essentially, everyone has an acronym. ALGE is our acronym, and it really talks about listening. What does it mean to listen non-judgmentally? How do we give reassurance, and information to someone who may be struggling? And how do we encourage that appropriate professional help or encourage that appropriate self-help? One of my favorite parts is also, what do we do when someone says that they don't want help? How do we move on to that? How do we engage with someone who's not ready to help themselves? And again, the biggest part of it is we don't diagnose, which is, I think we all very quickly can skip to that, and looking at stigma and looking at mental health and wellness for what it is. Stigma reduction becomes part of that. I do a lot of training with, first responders, different populations. And I always try and say, if you have a brain, you have mental health. No one is outside of that. This is just facts. So that is ultimately what mental health first aid does. I talked about the evidence base. The key findings among it was that the literacy for mental health after participants took the training increased. Their confidence, and their likelihood to help someone in distress increased. And that the reduction of stigma and the increase of empathy towards individuals with mental health challenges was effective. I think empathy is a term that we all look at and we think about, but do we use it in a way that's really productive? And empathy truly is something, it's just like self-care. You have to practice empathy. It sometimes doesn't always come very naturally to us. And so even looking at how do we engage in that empathy, and then also, how do we take care of ourselves after we help someone else? And how do we engage in self-care that is meaningful to us? So looking at the data, it becomes really helpful. I always forget about the self-care piece, and Afia, who's one of our team, will tell you her favorite part of the training is self-care. But it's also a really important reminder as we look at the wellness of ourselves and the people that we work with, or the people in our own individual ecosystems. You can't pour from an empty cup. And again, one of the skills in mental health first aid is filling that cup back up effectively, and then coming up with a plan of who holds you accountable when you're not refilling that cup. So it's one of my favorite trainings over all the years. So we're currently providing this training for free for adults. In the capital region, that is provided through a SAMHSA grant through Albany, Saratoga, Schenectady, and Rensselaer counties. The way that this breaks, there's different groups in mental health first aid. Some of them are specialties, which are military, veterans and families. There's fire and EMS, public safety, corrections, older adults, rural populations, indigenous communities. Glenn, I feel like I'm missing some of these specialties on the adult side.
I think, yeah, well, obviously it's the primary care providers, which you've listed here too. So, yeah.
Yeah, so this training, the adult mental health first aid, is being provided for free for these populations in these 4 counties. If you're on our website, there's trainings that kind of pop up consistently about what it is, like about open virtual trainings, adult trainings. So you can keep an eye on the website for some of the adult. This is being offered right now throughout. And then we also have the teen and youth mental health first aid, which is going across the state. The youth mental health first aid is virtual right now on our website. You can sign up for a class. We'll have classes all the way through 2025 that are open. Again, this is for adults working with youth ages 12 to 18. Talks about some of the, issues specifically around our youth and some of the mental health. We know that especially with the post-COVID, our youth are really struggling. There's the social media bill that is coming out. And I know, Glenn, that you're aware of that too. Part of that is how do we protect our youth, but also look at some of the issues that are specifically looking at school systems, bullying, school violence, different things like that. So that's open on our website right now. If your agency is interested in doing a youth mental health first aid, you can contact us directly. And then teen mental health first aid, which is, like I had mentioned, teens talking to other teens ages 14 to 18 now. So one of the things that does is we really looked at how agencies both across the state, whether you are a community, if you're a school community or you're an agency that is in schools, how do we get training into your area? How do we make sure that your school or your youth are being offered this kind of training? So we've got different sites across the state. If you're an agency that is providing services to teen, we would love to work with you, to teens, and engage in mental health first aid in that way. So that's another training that can be offered virtually or in person. We suggest the teen one be offered in person always. I should mention the trainings, mental health first aid for the adults is an 8-hour training. It is either 2 hours of pre-work and then 6 hours of training, or it's a full 8-hour day. We break it up to the best of our abilities as far as, making it accessible for everyone, the Zoom platform, but also the in-person. There are lots of materials that go out and different things that we look at to do. And then I think, Glenn, that was the mental health first aid. We went through time.
Well, thank you, Katie. And we also do a lot of trainings and, a lot of other trainings as well. So I think, Katie's done a great job as our director of training in general on some of the other programs that I talked about a little bit. We have training components to those as well. But I really want to, the numbers that we have accomplished in the last year, are just fantastic. We have been into communities across New York State. Obviously there's no cost to these trainings. Your agency can take advantage of them. It's a real, the New York State Office of Mental Health has given us funding to go out and provide those, trainings. And actually we have a governor who has been very engaged, and we're very pleased that earlier this week, she actually came to our offices to talk about the social media bill, but also to talk about how important it is to be engaged in mental health first aid, and especially about youth and teen mental health first aid, which are key components, we believe, in an individual's recovery, and also normalizing the path for the future for them. So we really think that the work that we have been doing in this, and we're not alone in this, there are other agencies that are involved, especially across the country, in youth and teen mental health first aid, but we've really seen we've really begun to see the fruits of this work here in terms of the ability to, again, normalize mental health, have conversations that are different conversations that we've had in the past. All the work we do, I was talking about the family piece, all the work we do is to normalize mental health and to have conversations at a family level, at any level, to talk about this and recognize that everybody has struggles in life. And that if we are smart and have the services and the structures and the innovative programs out there, then a lot of this can be resolved without, someone being diagnosed or misdiagnosed at a young age, and all of a sudden, because of their misdiagnosis, they spend years and years in the adult system. No one wants to see that happen. That's a lot of the work that we do here at MHANYS. So Katie, I don't know if you want to talk a little bit more about any of the other training programs that we are doing, some of the other things, some of the work, I know I talked about community partners and care path, but maybe if you want to talk about that a little bit more, not to put you on the spot, but,
To say some of the ways that we look at wellness, I think it is defined by the individual and what wellness means to them. I think when we look at also the resilience that has to happen in the individual, looking at resiliency programming is something that we look at a lot too. When we think of, and the chat's disabled here, but I always love the engagement piece. When we think of resilience, what does that mean to you as the individual? When you're being resilient and you're engaging in self-care, what does that mean? And then how does that support system come into play when it does that? And I think that's truly, when you think of the 8 dimensions of wellness, that is where CarePath and community health partners come in as teaching your support system how to best support the individual and engage in that way. Some of the other programming that we do, I call them our bump outs. And so when we look at that, I know, Glenn, we have all of these mini micro trainings that kind of also come through. So we have Mental Health 101, which is like an introduction to community mental health literacy. We want to make sure that it's, you get an introduction of what is a mental health challenge? What is a crisis? Like, how do we define some of these things in a way that's productive, but also shortened to an hour? We do some other training as far as, making sure that we talk about suicide and safe talk training. We want to make sure that we look at science of addiction and recovery. We have a resiliency program, which can look at becoming a resiliency officer, and how do you look at resiliency in the culture of an agency, of a workforce that becomes productive. Compassion, fatigue, and burnout training, which I think, especially post-COVID, when we think of the level of compassion fatigue that's kind of happened in the provider community, that's another training that, when you think of it, it's also that self-identifier. What does that mean? Is this happening to me? How do you take that on and look at that? But then what do you do if that is you? So some of the tools that go along with that, again, become really important, and that acknowledgement, and even shorter resiliency trainings and self-care, and coming up with a self-care action plan can be important. When's the last time we sat and really looked at, how do I productively take care of myself, which doesn't need to be a full day. Some of these are just kind of like an hour long trainings. CarePath, and especially our community health partners, they look at shorter, longer trainings so that we can really get that content to you and process that content productively.
I just want to add one more thing to that, Katie. Thank you very much. The other thing I just want to talk about, and I realized I didn't talk about it earlier, is issues around pipeline. Pipeline is a huge issue. We are trying to attack the workforce crisis on a lot of levels. Obviously, the immediacy of fighting for a cost of living adjustment, the COLA, that's kind of, you know, been our lead advocacy voice for many years in terms of fighting for fair wages for our workforce. Then the other thing is to be aspirational and talk about things in the future. What can we do? And that's the pension bill. What do we do around that? But we're also trying to say, what else can we do in the future? The other thing we can do in the future is we can integrate and motivate and educate our young people to develop careers in our fields. You know, back in the day, you know, and granted it was 1,000 years ago, but when I was young, we used to, you know, we had career days and nurses would come in and others would come in. Nobody, you know, even now, this version of career days among young people, nobody is coming to 11th, 12th graders and saying, I want to be a mental health professional. I want, you know, engage in mental health. That's not happening. And I think we're missing the boat here because, you know, we have developed strategies where we know that young people are engaged in mental health conversations. They are very open about it. It's a pleasure to walk into a school and hear young people, you know, no stigma bias. They talk about their mental health issues so openly, and that's great in many ways. So how do we capitalize on that and say, boy, this is great, you're like that. Now let's talk about a career in this field. What can we do at a young age? And I'm talking about things like the whole idea of taking a young person when they're in 11th, 12th grade, and not necessarily, you know, a lot of people don't go the traditional college route. You know, they might say, I'm 18, I want to start working. I'm interested in the mental health field. How can I get involved in the mental health field? Start as a paraprofessional and move up the ladder, take the training courses necessary, take the experience of working for a provider agency, and grow your credentials so you can move up the ladder as well. There are career ladder steps that you can take advantage of. So you can start a career as someone at the age of 18 as a paraprofessional, move up the ladder. You know, you can be a peer, not a peer, just someone who's interested in the field, move up the ladder, have those options available to you. So we're all about that, and we're trying to figure out ways to expand those ideas. We're looking at ideas around micro-credentials. We're looking at ideas as something that we're promoting with the Office of Mental Health called the Qualified Mental Health Associate, where somebody, it's much like, for those who are familiar with it, and my son is one, is a KSAC. So he's a substance use counselor. He didn't go through your traditional college. He took a year of training. Now he's working in the field. And as soon as he gets enough experience, he'll be a full-fledged KSAC and can again move up the ladder. That's exactly the kind of thing we're looking for in mental health, is to take someone young, get them the experience. They're not clinicians. They're not going to diagnose, but they're going to work with clinicians and they're going to provide all those ancillary support services, key services that will help somebody as they recover, as they move towards their path of recovery. So that's one of the other programs where we're really working on and paying a lot of attention to also. And I suspect we're going to have a lot more information on that coming out. There's some legislation which we're hopeful about next week. We'll see what happens next week, but we're certainly hopeful and optimistic that something will happen through legislation as well. So we're really, you know, we think we can look at this from so many different angles, but the COLA alone is essential, but that by itself does not keep people in our fields. If you're making $25,000 and you're getting a 3% increase, hey, nobody's knocking more money, believe me. We fight for that every year, but that's not what's going to keep you from working at Amazon. We need to do more. We need to create more funding, more opportunities for young people to stay in our field, and that's what we're all about here. That's a lot of our trying to be innovative in that space. So, and I don't know, Katie, is there anything else from your end you want to discuss?
Glenn, there's been lots of questions about the affiliate network.
Okay.
How people can find information for the affiliates, who the contacts are in their area or region.
Sure.
And why
Sure.
MHANYS isn't located in every county.
So I wish we did have them in every county. We have 26 and 50 counties. If you're ever interested in developing affiliates in the Syracuse area, Utica area. We're certainly looking for folks, and even the Capital District. But what the best thing to do is we can, after this ends, Blaze, we can send you the list of all our affiliate directors and all our contacts across the state. So you individuals can reach out to the different folks in their region of the state. We can certainly do that.
Yeah,
And see.
that's perfect. And I will also send the I assume it's okay for me to distribute the slides as well to
Oh my God, they're so secret. Yes, of course.
well, hey, you know, I
I know,
and
I know.
I should have asked you that an hour ago when
That's quite
we
all
were
right.
doing the you know, our tech screening and our backroom you know, interrogations and whatnot. But
That's right.
all right, well, super. Thanks
There's
for
some
that.
proprietary.
But yeah,
problem.
and of course, the webinar recording, there will be two links. The one link will be the regular recording, and then the other one, which will be a YouTube link, has the ASL interpreting and captioning as well. So yeah, so you'll get all that in a follow-up email on probably Monday is when you folks will get all of that info. So I know we are seeing more questions come in. So Katie and Glenn, I will let you go through and answer them here in the 15-ish minutes we have left.
Absolutely. So I would say that one of the questions, were there any training programs virtual in New York? And yes, so a lot of what the training happens, part of MHANYS is that we are getting training across the whole state. So the Youth Mental Health First Aid is virtual. That can be, you can access it anywhere in New York State as long as you have service. I live in Greene County, and some areas in our county don't actually have broadband, which makes it difficult, but you can take some of our trainings. We also have a learning management system. So some of our trainings are offered virtually on our website. So we'll send that link out with the PowerPoint. The information also at the end of the PowerPoint, the info@MHANYS.org is a great way to get a hold of us. The QR code is linked, and also our phone number is on there for the agency so that you can reach out to us and to the agency. I think that, you know, again, our goal is to meet the needs of the community, but we don't know all the time. So telling us the trainings that you want, where we need, you know, how we can partner and even advocate together, we want to hear that. You know, Glenn speaks very passionately about his advocacy, but there is the legislative action community. You know, they meet regularly, they look at policy, they talk about issues. And so truly, I think when we look at how does change happen, advocacy is how that happens, and legislation is how that happens. And so, you know, I encourage everyone also to look at our website and look at the different items that are listed. Glenn is such a pioneer of some of the advocacy that's been done, and I truly think partnership and more voices that add to that, there's such power in that for everyone. So again, that's on the MHANYS website. It's our action community there. And we're still in May, everyone. It is still Mental Health Matters Month. On our website too, you can take the pledge of why mental health matters to you and your community, and why talking about mental health and wellness is a priority. So I strongly encourage everyone to take the pledge. I think I can't remember how many people have taken it. Cohen just told me yesterday.
We're close to about 1,000.
We're close to 1,000.
We need to get over that hump.
Yes. So please go take the pledge, even if you don't want to do it publicly. Sign up, add your name to the list, so we make sure we get a good showing of why mental health matters in each of our own little worlds here.
Yep.
What kind of support for young children with mental health issues and don't want to attend the school? School is not providing any support. Yeah. You know, there is so many specific things that are happening in communities right now post-COVID for our youth. The only thing for us, I would say, is also looking at taking a youth mental health first aid just to have conversation about that. Services, as we know, across the state are struggling as a whole. So I'm just looking at the questions in the chat. So, I think making sure you just keep advocating and looking and then educating about what's there. Sometimes, the schools are also overwhelmed.
Right.
The School Mental Health Resource Center has great resources for that too. There's different cafes and different educational opportunities for parents, for caregivers, for guardians to talk to. And looking at even for school staff, how do they access some of that? So,
and I just to elaborate on that for a second, Katie, we do, as I talked about in the beginning, we do have a school mental health resource and training center. This is what they do. So for that question and others like it about, struggling, frustration with, youth who aren't even in school, what can we do? Reach out to them. We're always try to be as responsive as possible. So please reach out to them. You'll see them in our website. They will be very responsive and very, very helpful in terms of providing information. Please reach out.
Are there any more questions? And did we miss any questions?
Did we? Yep. Great. Yep.
Nicole, if you can help me with facilitating that, that'd be great.
I've been paying attention to the chat, Blaze, or the question and answer. Not
Oh,
the
awesome. Thank you, Katie.
teamwork, everyone.
Thank you, Katie.
It makes the dream work, that's for sure.
Yeah.
Absolutely.
I do. There we go. I just turned on my camera. I do wonder, what is it that we can be doing here in the short term to improve our collaborative advocacy?
Well, thank that, Blaze. That's a great question. I think that's a seminal question here. I think one thing we can do, and I know, you're a great advocate, Lindsay's a great advocate, everybody, independent living centers are. I think we need your advocacy voice to be key around the workforce issues. I think when you weigh in on that, and I think that's really important. You're also, I'm sure you're also struggling in terms of being able to hire people and the frustration of people leaving after months for higher paying jobs. I think that's where we can really collaborate. And, for whatever reason that is, unexplainable to me, that you have not been part of the COLA, that independent living is not part of the existing COLA structure. And we have to change that. There's no reason that you shouldn't be part of, as we struggle to fight for a COLA every year, there shouldn't be any reason why you're not included as part of that as well. So we definitely have, I think that to me is where we can really start. There are lots of other areas, but I would suspect that I think that workforce and advocating together around workforce issues would be, I think, integral to us working together.
For sure. I mean, there is a bill that is floating around the legislature, sponsored by Senator Prasad and Assemblymember Havesi, to include independent living centers and other agencies in the human services COLA. I mean, the short answer of why we're not at this time is because our money comes from the state education budget. So that has a significant part of it.
Yeah. And I know, and obviously you have a great advocate and lobbyist in Kevin Clearing, and he recognizes that too. And I think that we have to get past, because there are a lot of other not-for-profit agencies. You referenced the legislation. There are a lot of housing providers, there are a lot of school-based providers. For 17 years ago, when the COLA was first developed, they were not listed. And now every year we go back and we fight for that COLA with that same language. And the legislature and the administration have to be more welcoming about adding these different groups. So I agree with you 100%, and that's something we have to continue to fight for. Thank you.
For sure.
There are a couple more questions for Katie.
All right, and we've got a few minutes, so we'll go to the questions and then we'll put a bow on the webinar here.
All right, so I don't know if I see them. I saw the Onondaga County. I went through and I responded and sent emails and the links to the different our MHANYS.org.
It says any programs or trainings that are virtual in New York.
Yeah, so on our website, if you go to training and certifications, you will see the list of all of the different trainings that we offer. It will tell you which ones are virtual, if they're going to be in person somewhere. And then there's also the affiliate list on our website, which will get you, if an affiliate is doing different trainings and areas you can get on their website and also check that.
Thank you.
I know I was trying to plow through. I was going in the wrong order.
I'm having a tech issue getting the Q&A box to show up here. But
I
again,
she answered most of them. So I think we're good.
all right, and again, look out for an email from me, Blaise Bryant, on Monday with the follow-up materials, including the slides, recordings, and other resources Glenn and Katie are going to send along. So Glenn and Katie, thank you both very much for this fantastic presentation and how we can help with collaborative advocacy, and certainly in the independent living space. I sure hope that this presentation encourages us to talk more about the mental health and access to those services as well. So with that, stay tuned here in the next week or two for June's webinar. We had to move some stuff around because of the most integrated coordinating council meeting on June 12th with the Office of the Chief Disability Officer. That's happening at the Empire State Plaza, meeting room 6 in the Convention Center from 1 to 3 on Wednesday the 12th, which normally we would have had a webinar then, but it is, it's more important for us to be showing up and holding the office and the council accountable to advance the rights and dignity of people with disabilities. Oh, did something else just come in here as I was buying time?
Joyce said thank you.
Oh, you're very welcome. So with that, have a great rest of the day. Enjoy the nice weather, and we will talk soon.
Thanks, everyone.
Thank you. Thank you, Blaise. Thank you, everyone. Thanks, Katie.